We want to welcome now Sarah Neil Pilkinton, who is an outpatient nutrition education coordinator, very important title over at Williamson Medical Center. Thanks for sharing some time today with us.
Thank you for having me.
We really appreciate it. You know everything about what we're supposed to be eating, and you know what we put into our bodies is so important. So talk a little bit about the importance of good nutrition, please.
Well, good nutrition is important because it affects so many things about our bodies as far as maintaining a healthy weight. But the more that we learn about nutrition, the more we realize how much it helps prevent so many chronic diseases.
So tell us the types of foods maybe that we should be implementing every day into our diets.
Okay, so I like to think strive for 5. All right, so we're going to start with our lean proteins or lean meats, low-fat dairy or fat-free dairy, those fresh fruits, fresh vegetables, and what's really important are those whole grains as well.
A lot of people would probably say, you know, when I'm making out my grocery list on a weekly basis, I can't put those healthy foods down because I know they cost a lot. What would be your response to that?
I hear this a lot, and what I usually say is just like any other item in your family budget, you need to prioritize with what's important first. Specifically, those 5 things that I just listed, those are probably the most important items on your grocery list, okay? So budget for those first. And then if there's extra money left over, then maybe going for those foods that are not as nutritious. Another thing is, a lot of people don't realize this, but research actually has shown that healthy foods really are cheaper than those convenient food items. The problem is the education to know how to pick out those fresh fruits and vegetables, how to prepare them. And one of the things that I see most often is the lack of planning that those things require. You've got to make time to cut, peel, wash, cook, and that all takes time. The convenient fast foods, the nutrient poor foods, they're very grab and go, and they're easy to grab quickly when you haven't made a plan. Okay. The other thing is, I have a couple of examples I usually give for things. So compare a bag of potato chips to a bag of potatoes. They're both roughly about the same price, but which one is going to last longer? You're more than likely going to eat through that bag of potato chips pretty quickly, but that bag of potatoes is going to last a while, right?
Absolutely.
Think about an apple pie compared to a bag of apples. About the same price, but which will last longer and which is healthier? Instant oatmeal compared to old-fashioned rolled oats. You can spend about the same amount on each thing, but which one's going to give you the better nutrition and going to last longer?
And it seems like you can make so much more when you're talking about the bag of apples, the bag of potatoes.
Exactly.
I mean, you can be creative, implement the kids, get them involved with the recipes and that kind of thing. But
it all takes time, and it takes planning.
That's right. Let's also talk, if you don't mind, Sarah Neil, about the actual current nutritional guidelines. They seem so different from what I grew up with and what a lot of people remember.
I know. I remember the food pyramid.
Yes. On
the bottom were your grains, and you're supposed to have that for the majority of your food, working its way up to the fruits, the vegetables, the dairy and meats. So what we have today is the My Plate version. And the thing that I love about it is it helps people visualize what their plate should look like. Okay, with half of your plate being those fruits and vegetables, on the other half of your plate being those whole grains that we talked about, the lean proteins, and then maybe having a glass of milk or a cup of yogurt to the side.
That's great. And also talk a little bit about portion control too with those kind of things. Because when you talk about, you know, the nutritional guidelines and what we should be seeing on our plate, obviously you shouldn't see a large amount of it too. I mean, I always give my kids more strawberries if they're still hungry after lunch, but you don't want to overfeed yourself at any meal, really.
Exactly. So with everything, choosing lean is typically going to be important, but then also portion sizes. Just because it's good for you doesn't mean you can have as much as you want.
Okay.
But I think first, maybe even just taking your plate and working towards getting those components of the plate lined up is a good place to start, and then work towards portions.
Very good. All right, recent news reports point to an overconsumption of salt in our diet nowadays. What are some things that we can do to keep salt out of our diet, or at least know how much we should have?
Okay, so first of all, let's start with how much should you have, because doing a lot of the things, they're not going to mean anything unless you know what your goals are.
Very true.
So first of all, what are your goals? For most Americans, your goal is less than 2,300 per day. Okay, and you can think and try to break that down, divided by 3 meals, and maybe you'll leave you a little bit of reserve for snacks. Okay, now for adults who are over the age of 50, who have high blood pressure, kidney disease, or diabetes, you really should strive for less than 1,500 milligrams of sodium a day. So how do you do this? Choosing the most fresh fruits and vegetables is best. If you can't choose fresh, frozen without a sauce or a gravy also works well. As a last resort, you can choose a canned vegetable, but you really want to try to make sure you rinse those well, or choose one with no added salt.
So a lot of statistics recently now say that Tennesseans are inactive.
That's right, and you know, studies are showing that being inactive is just as dangerous for our health as smoking. I think that brings a lot of attention to inactivity, kind of really showing how important it is to get out there and be physically active.
Let's also talk about exercise and how that fits into lifestyle in general.
Okay, so I like to think of this as calories in, calories out. So the calories in are going to be the calories that you eat, and to maintain a healthy weight, you've got to burn off as much as you take in. So when we consume more than we burn off, that's what leads to weight gain. Okay, so that's where physical activity plays into
Sure.
Balancing a healthy weight.
Yeah.
So in order to move that equation a little bit more, increase that physical activity so you can burn off more than you're taking in, and weight loss will result.
Yeah, and you have to keep that in mind, because it's not just about what you're, serving up at every meal. It's also about what you're doing in addition to that.
Right, and I tell patients a lot of times when I see them who are overweight and they say, I don't know why I'm overweight. I eat all the right foods. And then I quickly go to, well, are you exercising? And then we start talking about ways to increase exercise, to increase that metabolism, to balance out that equation a little bit better.
Sure. And body mass index, something else we have to keep in mind, BMI. A lot of people have heard of this before.
So what a BMI is, it's a number where we've calculated a height to weight ratio, okay? And research has shown that the higher the BMI, typically the more body fat someone has, the lower the BMI, less body fat.
All right, so a lot of things to think about. Thank you so much for this great advice. We so appreciate your time today.
Thank you.